Business and financial news from across the subcontinent now on BBC World. In India, Business Report.
Founder Dr. P.S. Warrior decided to combine ancient formulae with the latest machinery and scientific techniques to produce modern Ayurvedic medicines. What he ended up with was a breakthrough no one had thought of yet, the Ayurvedic pill.
This is for the first time Ayurvedic medicines are available in a bottle condition. First time ready-made. You walk into the physician's room and he gives you the medicine after examining you. That was not available in the past. That has completely revolutionized the healthcare system itself.
In its first year, Arya Vaidya Sala made a small beginning with medicine sales over just 1,000 rupees or $22 in today's terms. But almost all of this was through founder Warrior's own clinical practice. Other Ayurvedic doctors still preferred to make their own medicines. Dr. Warrior felt the need to introduce Ayurvedic doctors to Western allopathic medicine. He published a book on modern anatomy for his contemporaries, another first for Ayurveda. Dr. P.K. Warrior, the founder's nephew and managing trustee of Arya Vaidya Sala, explains.
When he studied both, he understood that basically this is more scientific, this is Shastra Ayurveda. But there are something to be developed in it. Especially this anatomically, it is the development is a little bit less. There is, but it is not up to the mark.
While his unconventional methods earned him a growing following among patients, his contemporaries continued to ignore his efforts to modernize Ayurveda. Dr. Warrior needed more doctors at the clinic and decided that he would have to train his own. The Ayurveda Pathshala was set up in 1917 and later became the Ayurveda College at Kottakkal.
കാലാനുസൃതമായിട്ട് പരിഷ്കരിച്ചിട്ടുള്ള വിദ്യാഭ്യാസമാണ്. അത് അനാട്ടമി, ഫിസിയോളജി ഇങ്ങനെയുള്ള കാര്യങ്ങളൊക്കെ ഉൾപ്പെടുത്തി, അതുപോലെ തന്നെ പുതിയ വൈദ്യത്തോടുള്ള പരിചയം വേണം. ഇത് രണ്ടും കൂടിയിട്ടൊരു സിന്തസൈസ് ചെയ്യാൻ ചാൻസ് ഉണ്ടാക്കുന്ന ഒരു വിദ്യാഭ്യാസ സിസ്റ്റം വരുത്തണം എന്നുള്ളതായിരുന്നു അദ്ദേഹത്തിന്റെ വിഷൻ. കറക്റ്റ് വിഷനുമായിരുന്നു. ഇപ്പം മോഡേൺ സയൻസുകാരും ഒക്കെ തന്നെയാണ് പറയുന്നത്.
Over the next 7 years, as word of the efficacy of Dr. P.S. Warrior's medicines began to spread, other Ayurvedic physicians began prescribing these to their patients. By 1924, the sale of medicines had jumped to over 71,000 rupees or just under $1,600 in today's terms. To popularize the medicines further, Dr. Warrior decided to do away with his consultation fee at the clinic. He also started a charitable hospital for poor patients. By the time Arya Vaidya Sala celebrated its 25th anniversary in 1927, its medicines had become popular throughout Kerala. Sales were just below 98,000 rupees or $2,200. For his efforts to revive Ayurveda, Dr. P.S. Warrior was awarded the title of Vaidya Ratnam, Jewel of Physicians, in 1933 by the British rulers. As the demand for medicines grew, Arya Vaidya Sala faced a new problem. It was getting difficult to find high-quality raw materials.
These medicinal plants are procured from our forests and natural habitats with the help of professional herb collectors and suppliers who supply them to the factory. But due to rapid destruction and overexploitation of our forests, many plants have become rare and endangered, many are on the verge of extinction. The non-availability of genuine drugs in required quantities force the pharmacists to substitute or adulterate with the easily available and spurious ones, which tells upon the efficacy of drugs.
Dr. P.S. Warrior knew that it would be impossible to grow all the medicinal plants needed in-house. So he decided to set up a 115-acre herbal garden 30 kilometers from the factory. This garden which was established in 1934, now supplies Arya Vaidya Sala with the 400 different varieties of best quality herbs that form the benchmark for all external procurement.